So, good day, my name is KARL from BSN M4A. So, for today, I'll be doing or making a video about cold compress. So, first, I'm going to verify the client's identity using three identifiers. Sir, may I know your name?
John Leonardo from
Okay. How about your birthday? May I know your birthday, sir?
June 22, 2007.
Okay. May I check your wristband? Okay. After doing those three identifiers, I'm going to verify the doctor's order for the type of moist application, location, duration, as well as the temperature. So, assuming that I'm verifying the doctor's order, after that I'm going to review the patient's or client's medication record or history, as well as if there are any contraindications to be aware. After that, I'm going to assess the client's skin around the area for the temperature and pain sensitivity. So, may I check your pain? Is it painful when I touch?
No.
It's not quite painful. Okay, thank you so much, sir. After that, I'm going to inspect the wound if there are any. So, since there is no any wound in the patient's left arm, I'm going to move on to the next, which is assessing the client's and family awareness and understanding of the procedure. So, assuming that I already assessed the client and family awareness about the procedure, I'm going to assess the client's vital sign and mobility. So, first, I'm going to check for the patient's oxygen saturation using oximeter. So, I'm going to use the patient's left arm, since the patient is has an injury on the other arm. So, okay, the patient's oxygen saturation is 98, which is normal, and the respiratory rate of the patient is 16/20, which is normal. So, I'm going to check for the blood pressure. Okay, so the client's blood pressure is 120/80, which is normal. After that, after checking the client's vital sign, I'm going to identify the expected outcome. After identifying the expected outcome, I'll be assembling and preparing the equipment needed for the cold compress. So we have here the basin, the towel, and the ice, as well as the towel we're going to use for the ice compress or cold compress. Next, after assembling, I'm going to explain the procedure to the client and completely get their consent. So, sir, for the cold compression, I'll be checking and applying cool sensation in the injured area, as well as to reduce the pain, swelling, and inflammation of the pain or the injured area. May I have your consent?
Yes.
Okay, thank you so much, sir. So, after getting the consent of the patient, I will now describe the sensation to the patient and how and what would the patient feel. So, sir, you will be feeling a numbing and cool sensation on the injured area, where I will put the cold compress. Is that okay?
Yeah.
Okay. After doing that, I'm going to provide privacy for the patient by closing the curtains. Okay. After closing the curtains, I will now place a waterproof pad under the patient's arm to protect the linen, as well as the patient's other body parts, to prevent from getting wet. Okay. So after that, I will now place a waterproof pad under the patient's towel underneath the body part. After placing it, I'm already done with that. So I will now submerge the gauze or the towel in the cold water, and then I will apply it on the patient's injured arm. So, sir, is it cold?
Yeah.
Okay, so bear with it. Next, after that, I'm going to remove and then remoisten, as well as reapply the cold compress. So, remoisten and then apply again. Okay, sir, is it cold?
Yeah.
Okay. After removing that, I'm going to check the skin condition of the patient and within the irregular interval. So next I will check. So the condition seems to be improving. So I will now stop if there are any problems occur during the cold compress. So now I will remove my gloves and dispose of them properly, assuming that I've removed my gloves and put them in a yellow bin or yellow trash bag. I will now inspect the body part of the wound condition for evidence of effectiveness of the therapy. So after checking again, so seems like it's working. It doesn't swell anymore. So I will ask the patient to describe the pain level and comfort of the said therapy. So sir, may I know the level of the pain sensation that you're experiencing right now from the scale of 1 to 10?
1.
1. So it seems that there is no pain anymore that the patient is feeling. So I will now identify or ask the patient identify expected outcome. So after that the patient felt comfortable after the cold compress, I will now document and report the patient's information to the physician and perform hand hygiene as well.